Two moms, two devastating diagnoses.
When I was diagnosed with breast cancer, I was in the midst of running my child to football and baseball and karate, and I was a full-time working mom.
My husband and I were planning to have a second child very soon. We had bought a four-bedroom house 6 months prior to my diagnosis, and we're ready to fill up those rooms. And that all had to be put on hold.
Amy Bowen and Megan Crunkleton were both busy working moms when they were diagnosed with breast cancer. For Megan, just 33 at the time, breastfeeding and her sister's previous diagnosis raised a red flag.
I had my son in December 2015, and my sister, who's 10 years older than I am, was diagnosed with breast cancer January 2016. So kind of fast forward a little bit, I was nursing my son. He was almost a year and a half, and I felt a lump.
Unlike Megan, Amy had no family history of the disease.
I was diagnosed at 44, and I do not have any family history whatsoever, none.
Breast cancer is a frightening diagnosis at any age, but it's more common in older women. And so I think when a young woman is diagnosed with breast cancer, the initial reaction is just that much more shocking. There's a sense that the body has betrayed them and that they have no control over any of this because one doesn't.
Dr. Yvonne Ottavio, Chief of Medical Oncology at MedStar Franklin Square Hospital and Director of Breast Oncology, says for younger women wanting to start or expand their families, fertility issues are enormous. She says doctors are now taking a step back from rushing treatments, offering patients fertility preservation options.
Sometimes doctors that's not our first thought. Our first focus is, well, I've got to get this cancer out of you or get you on the road to treatment. I've learned over the years, and we have it in our policy, in our procedures, and our policies, that we must address fertility issues in a man at any age and offer them sperm banking, and a woman under the age of 45.
Dr. Ottavio says she loves to keep track of her post-chemo babies, and so far, she has 6.
I get baby pictures. I love to have them come to appointments. And, you know, that's part of why I do this, is because I want to see life go on.
She's seen in her practice 6 babies after chemo, and we're hoping to give her baby number 7 once I get cleared in about a year or so.
Now, fewer than 5% of women diagnosed with breast cancer in the U.S. are younger than 40. Rates begin to increase after the age of 40 and really at the highest peak for women in the age of 70 and up. The median age for diagnosis for breast cancer for women in the U.S. is